My name is Dr. Stephen Davis. I own Green Hills Plastic Surgery, and I'm a board-certified plastic surgeon and have been board-certified for over 30 years. I'm a member of the Plastic Surgery Society, and I'm a member of the Aesthetic Society, and board-certified through the American Board of Medical Subspecialists, Plastic Surgery. Today I'd like to talk about the Mommy Makeover. There's some great benefits to the Mommy Makeover. It allows us as plastic surgeons to help the patient improve the shape, form, quality, contour, and volume of the breast. It helps the patient improve the abdominal wall. It helps the tightness of the belly, the smoothness, the flatness, and the contour of the torso circumferentially. So let's look at the breast first. The first thing that we always look at, and I always try and look at with patients, is I think in layers. What is going on with the skin? What is going on with the fat tissue underneath? What has happened to the breast tissue? What are the pectoralis muscles like, and what is the rib cage like underneath that? So thinking layer by layer by layer, it then allows us to evaluate how we need to make changes to the breast. Classically, with breastfeeding and pregnancy, as everybody knows, the breast enlarge. Some women choose to breastfeed for long periods of time. And after that, a few things happen. The breast tissue dries up, some of the fat around the breast dries up, and the skin quality that has been stretched and pushed for long periods of time as a result of the pregnancy and a result of the breastfeeding, now its elasticity and tone is not great. So the breast falls. The nipple moves to the bottom of the breast. The volume of the breast has changed. The breast becomes flatter, and shape and form is gone. So how do you manage that? Again, if you think in layers, if the rib cage is good, the muscles are good, then you need to evaluate skin, breast, and what can we do about that? Implants are great in that sense. Implants allow for volume. Implants will compensate for the loss of volume because of the loss of breast tissue, because of the loss of fat. You still then have to deal with the next layer forward, which is the skin. The extra skin needs to be adjusted. The nipple needs to be repositioned. And typically one wants to place the nipple from the bottom of the breast to the central portion of the breast, allowing better shape, better form, and what we refer to as projection. All of those things are easily obtainable. All of those things can be discussed in great detail with your surgeon. And even with implants in the office, we have trial sizer systems so that we can place these implants and give you a very good feel as to what kind of shape, what kind of form, what kind of volume you would like. Looking at the abdominal wall as the second component of that, the same thing happens. Skin gets stretched, gravity works. The pregnancy is great. You have a baby, you've grown a family, but unfortunately the mother takes the toll, and part of that toll is on the belly wall. So things, again, as with the breast, we want to look at tightening the skin. We want to look at removing the extra fat. We want to look at contouring and changing the entire torso 360 degrees around. I like to do that. I think that if you look at just doing the belly and not liposuctioning the flanks or liposuctioning the back, you have a nice flat smooth contour, but then when you look at the sides or you look at the back, you've got fullness and volume. So I like to look at the abdominal wall and the entire torso of the abdomen in 360 degrees so we can make a total contour change, sculpted if you will. The last portion of this and the deepest layer are the muscles. During the pregnancies, the muscles get pushed forward, they get bowed forward, and in many cases they get pushed out to the side. So after the pregnancy, the muscles come back, but they do not come back typically in straight alignment. So the other portion of this is now managing the belly wall muscles. We like to tighten those and bring them back together in the midline, offering the belly a nice, tight, smooth, flat contour. There's also muscles on the side that extend around to the back. Those are the oblique muscles. In many cases with pregnancies, those muscles get stretched out. They lose some elasticity elasticity and they lose tone. And so part of also managing that is tightening those muscles. So again, we're looking at the abdomen and the torso in a 360-degree change. How can we adjust the skin? What can we do with the fat? How do we manage the rectus muscles? What do we do to the oblique muscles? And then as you move around to the back, what do we do with the flanks? What do we do with the bra roll? How do we adjust that so it's a very nice circumferential improvement to the belly wall? In many cases, we do combinations. We can do the abdominoplasty, the liposuction, the muscle work, and the breast lift with implants all at the same time. The classic mommy makeover. I hope that helps. If I may answer any more questions, please feel free to contact us at any time. We'll be happy to discuss this with you at Green Hills Plastic Surgery.